Well, thank you very much, and good afternoon, everyone. I appreciate you joining us here today. Today we are reporting 11 additional cases, including 10 from the far north as well, in and around the La Loche area. 4 of these patients are in hospital. 1 is in ICU, so our hospitalization numbers in Saskatchewan remain very manageable, as they have throughout this pandemic. While we've seen an increase in the number of new cases in recent days, almost all of these new cases are related to 2 localized outbreaks. One related to a recent funeral and wake in the Clearwater River Dene Nation, and the other in the RM of Maple Creek. In both cases, the Saskatchewan Health Authority is working closely with communities and community leaders to control the spread through testing, contact tracing, and subsequent self-isolation. We are confident that these efforts will be successful in limiting the spread of COVID-19, as has been the case with previous outbreaks. Yesterday, we moved to phase 4.1 of the Reopen Saskatchewan plan. Now almost all businesses, services, facilities, and activities in our communities across Saskatchewan can be open. So today I'm pleased to announce that phase 4.2 of the Reopen Saskatchewan plan will begin this Monday, June the 29th. Under phase 4.2, movie theaters and live event theaters will be able to reopen. And like any other business, they will need to follow enhanced cleaning and physical distancing guidelines that have been put in place. Like places of worship, crowd size will continue to be limited to 30% of capacity, or 150 people total, whichever is less. Also on June 29th, libraries, museums, and art galleries can reopen. Of course, all the guidelines for theaters and libraries, art galleries, and all other types of businesses and facilities can be found in the Reopen Saskatchewan plan on the government website. With theaters and museums allowed to reopen on June the 29th, really the only types of businesses that are not allowed at this point in time to open in Saskatchewan are casinos and bingo halls. And we expect to announce that reopening date very soon. A number of other restrictions are also being changed or lifted. Campgrounds, for instance, can book overnight camping at 100% capacity as of this Friday, June the 26th. Effective immediately, contact sports are now allowed. And spectators are now allowed at games, so long as they follow physical distancing measures. Showers, locker rooms, bathrooms at the campgrounds, parks, beaches, gyms, golf courses, and similar facilities can now all open. And change rooms in clothing stores can also fully open. Again, the details on these, as well as all of the other guidelines and restrictions, can be found in the Reopen Saskatchewan plan that is on the government website. Our goal continues to be, as it always has been, to reopen as quickly as possible while doing so as safely as possible. I'm very happy to be making these reopening announcements here today, but I will be much happier when everything is reopened and I'm able to quit making these reopening announcements. So with that, I will ask Dr. Shahab to make a few comments.
Thank you, Premier. So again, we can all see more outdoor activities happening, children outside, enjoying the summer weather. And again, I think the message here is that it has been a phased, systematic approach, and we just need to be aware that it is going forward in a new normal, not business as usual. So even as sports teams are training and maybe playing within a small bubble, just being conscious that obviously during sports you can have a bit of contact, but on the bench maintain that physical distancing. Just those small things I think we need to be aware of. And similarly, as we have, the weekend, there was lots of backyard barbecues happening. Again, just, if people are within your 15 people that are part of your virtual household bubble, you can get closer than 2 meters. But if it's people who aren't part of your household bubble, maybe just maintaining that physical distancing even in an outdoor barbecue. And we've been asked that question, virtual households can't overlap and become an infinite number of virtual households. So I think that's just something being aware of. We have seen quite a number of daily cases over the last few days. So while that is something that public health colleagues are actively following up, we have to recognize that they are linked to 2 ongoing outbreaks in the Northwest. many of the cases now are secondary household cases. So whenever there's a mass gathering or transmission event, you do see for a few weeks secondary cases of chains of transmission due to household contact. So that's what we're seeing in the Northwest. And obviously in the Southwest, again, there's ongoing active case finding that results in more cases being identified due to active case finding, going door to door, working with community leadership to enhance testing and make testing easily available. And that's why it's a good thing that we're finding as many cases as we need to just make sure that cases are isolated for the 2 weeks. Many of them will make a recovery at home, and those who require hospitalizations obviously will be hospitalized, and close contacts will also be asked to isolate at home for 2 weeks, and once they're asymptomatic, they can then continue with their activities. But again, I think the message there also is that relooking at everything we do in terms of celebrations, day-to-day events, whether we're eating together or praying together, just maintaining that physical distance is going to be critical for us as we move forward. Thank you.
Thank you, Doctor. Thank you, Premier. We'll take our first question from the room. Murray?
I guess mostly for Dr. Shahab, how do you think it's going to go? Because you're now in an area where you're dealing with darkened venues, very social venues. I assume that you're not going to have concessions open, I assume, because you probably can't according to your rules, but can you successfully police social distancing, all the other things that you want to still continue on at this particular point in these venues where it's going to be increasingly difficult the more of these things you open up?
I think one thing I like to say about Saskatchewan, specifically in Canada in general, is that we police each other all the time. And you hardly ever see anyone jumping out of a queue, and if someone does, there's others who say, hold on. And I think so that's just normal behavior. And then right now, if there's a queue, it's just 2 meters distant. And many venues will have markers to remind us to keep that 2 meter distance. But even if there's no markers, I think we just need to build that into our muscle memory, that even if we're going to friend's house, we need to help each other out to have the layout so that we maintain that 2 meter separation. Maybe plate the food out. One person plates the food out. In terms of movie theaters and those kind of settings, the concessions obviously have a food handling certificate, so they will give, a single family or a single person serving. And if you're part of a household, you can share your bag of popcorn. But if you're going as a group, not part of a virtual household, maybe not pass the popcorn around. And I think that's some of the things that I think we just need to remember as we're out enjoying events and venues. And we'll see how it goes. I think as long as we can maintain that discipline, we will see cases and clusters here and there. I don't think we can pretend that we won't, but as long as we see the occasional case or a cluster, we can manage that. And it's up to people also to go forward and get tested if they're concerned or if they have any symptoms, because that's really important. That informs us what needs to be done for you as a person who may be symptomatic, maybe transmitting your close household contacts, but also where did you get exposed, because then we can refine the guidance. So I think as long as we all practice what we've been doing as we start both going back to work, but also enjoying many of the opportunities that are now again going to reopen, we should generally see low case numbers, but we will see the occasional case or cluster which will need to be managed.
Why are you more confident than you were before? I remember the bag of popcorn was one of the examples that you raised earlier in terms of things that could possibly spread and whatnot. What gives you a little bit more confidence beyond the fact that you've had a newfound appreciation for good manners and social behavior within the province? There's still the reality that we're going to have teenagers there doing what teenagers do in movie theaters and such.
I think the confidence really comes from the fact that we know that 2 meter distance works for the most part. If you're singing, maybe more than 2 meters is a good idea, or doing some vigorous exercises, more is better. We also know that in some jurisdictions, for example, for schools, for example, they're looking at even 1.5 meters. So that's really important. Staying home when you're sick, that's important. So we know what works, and that's important. And so based on that, and we also know that when people are closer together in a larger crowd, when people are sharing food or otherwise socializing close together, that's when you do get mass transmission events. So I think we're aware of how we can minimize transmission, but not eliminate it totally. And we're also aware that the settings, whether it's in a friend's backyard, or whether it's at work, or whether it's at a movie theater, we all need to self-monitor ourselves so that we give each other the space, so that we can all enjoy what we are out to enjoy, but also, protect each other from exposure to COVID-19. Either we certainly should be out and about if we're symptomatic, but even if we were asymptomatic, giving that space is important. And of course, I've started talking a bit about mask use as well, that in settings where you feel that you won't reliably keep the 2 meters distance, always having a mask in your pocket. I think I have one here, which is a good thing to put on if you can't maintain that 2 meter separation.
We'll take our next question on the phone line.
We have Roberta Bell with Global.
Hi, my question relates to the, rallies we were seeing happening, the large kind of public groups that people were having in terms of, anti-racism movements. We saw lots of people, hundreds of people get together, outdoors. And have we seen any evidence that there was increased transmission as a result of any of these events?
So we, at the moment, most of the cases have been linked to the two outbreaks, Northwest and Southwest, and a few cases linked to international or interprovincial travel. We have not seen any cases linked to, rallies. But again, if people had gone to those rallies, or if people have members in the household who went to the rallies and have any symptoms, it is important to seek testing, because again, any situation where there's a crowd, as long as people are practicing physical distancing, sanitizing their hands, wearing a mask, I think that minimizes the risk of transmission but does not eliminate it. So the second then layer of protection is obviously to seek testing. If you were at an event, or you had a household member who was at an event 2 or 4 weeks ago, and then if you or anyone else in the household is having symptoms, seek early testing and advice from public health.
Follow-up, Roberta?
So what does that say to officials, health officials, about the situation in Saskatchewan and about the spread of COVID-19, that there aren't any cases linked to those events right now?
So I think the first thing is that we had a low overall transmission. We overall have low transmission at this time, and that's evident by several factors. Obviously, we have, not high testing rates, but fair testing rates throughout the province. We have low test positivity rates, very low in most of the province, except in the two outbreak clusters. And we obviously have very low hospitalizations and ICU admissions. And thankfully, while 13 deaths too many, we have low number of deaths. So all that shows that our COVID transmission is not zero. We can never assume it's zero as long as there's a global pandemic, but it is very low. So I think that would have mitigated any intense transmission events through mass gatherings. But we have to remember, like in the Northwest and in the Southwest, COVID can come back very quickly and it can spread very quickly. So we do need to observe all the precautions that we have in our guidelines going forward.
We'll take our next question from the room. Adam?
For Dr. Shahab, are there any recommendations going forward for people that are wanting to travel this summer interprovincially? Because I know some of our cases are linked to travel across the border, and we have a long weekend, holiday coming up. What's your recommendation to people traveling inside and out of Saskatchewan?
Yeah. So we are having discussions with our neighboring provinces. So all provinces are kind of looking at their own recommendations. For example, we had said, non-essential travel is not recommended. We are working with the neighboring provinces to have a more permissive approach. But I think when you're traveling from one province to another, or even if you plan to go to a specific part of either within Saskatchewan or in another province, I think it's good to check ahead in terms of what's happening in that province, and even locally, are they open to camping or hotels for people who aren't from that province. My general advice, though, is that, do more things locally than further away from home. Even if you're going out for a walk, everyone doesn't have to go to one place in town. You can go for a walk in your neighborhood or the neighborhood next to you. I think doing things locally is better than doing things at one site within a city or community. And enjoying what you can enjoy closer to home is better than going further away. So that's a general recommendation. But having said that, if people do want to travel interprovincially, I think they need to make sure that they check to see what's permissible in the other province, And they need to plan it ahead in terms of, is everyone asymptomatic? What's the plan if someone does get symptoms? You have to, contact local public health where you are. But generally, I think taking it slow this summer, enjoying the amenities locally is probably a recommendation that I think is something worthwhile for most of us to follow.
Can you make it clear what the current recommendation is around a bubble? Because people are asking questions now, my bubble can expand. We're seeing all these different things open up, like if I go to church or I go to a restaurant, maybe I'm in contact with different people. What's the current guidance on bubbles?
So the way the guidelines are for places of worship or restaurants is that if you go with your household or your virtual bubble, which is up to 15 people, 3 to 5 households, or friends. If you go to a restaurant, you're sitting as 6 people, that's your bubble, and which you may be in your backyard or in a restaurant, and you should be separated from staff or other guests at the restaurant because every second table is empty. Staff, the way they serve, they're maintaining that physical distance, or maybe having a cloth mask. So I think the way the guidelines are set up is that you should really not be able to say you were a close contact of anyone else apart from your group. And same as I would expect if you go to see a movie or a show is that, the way you get your tickets and get your concessions and go and sit, the separation should be such, or even when you're going for prayers, the separation should be such that you shouldn't really feel at any time that you're closer than 2 meters to anyone who's not part of your household or virtual household. So I think that is really important for us to just build into ourselves that discipline and awareness, and that really will keep all of us safe.
We'll take our next question on the phone line.
We have Lisa Schick with CJME.
Hi. Just looking at the second part of phase 4, it seems like you're kind of splitting that into 2 as well. So why did you make that decision?
So first of all, I think phase 4 itself was quite big and very diverse sectors. Phase 4.1 was more outdoor activities. The weather is beautiful. It's really important to get out early with that. Phase 4.2, galleries, museums, libraries. Again, the guidelines are out there. The guidelines for the other sectors will be coming out. I think it is important to be thoughtful about how other sectors will work, and they should be coming out fairly shortly. So the entire phase 4 should be done, fairly quickly. But it was important to not delay things unnecessarily either, but you just spread it out so that businesses can think through how they're going to start. And obviously, not everyone has to start on the day of the reopening, but certainly we hope that businesses can think through their business model given the guidelines. And a lot of feedback has been received that's very good. And ultimately, businesses are the experts in terms of how they, based on the layout, can plan things. We've seen that done very successfully in the retail sector. But it's also important, the guidance I think is 100+ pages, but I think it is important for all of us as much as we can to read through the guidance so that we know what to expect when we go, and then no one is surprised and no one is kind of not kind of following the guidance. I think that's very useful as well, and that would just make it for a smooth experience for all concerned.
Follow up, Lisa?
Yes, it's only been a week since the first part of phase 4 started. I know when the reopening started, you talked about wanting sufficient time to monitor the effects of a phase before going on to another one. So why is the second part of this phase happening so quickly, especially as our active case numbers are trending up again?
Yeah, so that's a good point. So I'll answer maybe in 2 parts. One is that the more we learned about how phase 3 went and how it was successful, I think it didn't make sense to artificially delay everything till all the guidelines were developed and 4 to 6 weeks had elapsed. So that would have been like middle of July. I think it made sense to really open some of the phases that relate to outdoor activities earlier. And that probably makes it easier for businesses to also start reopening when they see that they're comfortable with that, as well as sports teams. And while any case is a concern, I think we have to recognize that while the 2 outbreaks in the Northwest and Southwest are a concern, they are linked to specific geographies, specific settings, and public health is engaged with the communities and the leadership in managing that. We are seeing very low numbers of pop-up COVID cases in the rest of the province. But having said that, I think we can't be complacent about that. I think we should be cautiously optimistic. we should continue to practice physical distancing, hand washing, staying home if you're sick, consistently as we re-engage in all the phases that are reopening. I think that is going to be really important going forwards.
We'll take our next question on the phone line.
We have Mark Smith with CTV.
Hi, will teams that can physically distance be able to travel within the province to compete in games?
I think at the moment, the recommendation really is that obviously you can start training within your team. You can make a small bubble of 2 or 3 teams, maybe up to 30, 50 people, depending on what sports it is, and play within your bubble at a local level. I think that's the safer option to do. And we'll see, because certainly, we did see in March that there were transmission events through sporting events and some of the socialization that happens afterwards. We're hoping that with some of the new guidance about how we maintain that physical distance while we are playing, maybe not while we're on the playing field, but on the bench, and how we socialize afterwards by maintaining that 2-meter distance, we're hoping we will avoid some of the transmission events. And certainly we don't want those transmission events jumping from one place to another. So I think some caution around interprovincial or even travel within the province will stay for the time being, and we'll see how the summer goes and relook at some of these things later on.
Follow up, Mark?
Yes. What were some of the concerns that led to the opening of indoor pools, rinks, and sports, as well as casinos and bingo halls being delayed further from 4.2?
I think it's not so much of those sectors being delayed. I think a lot of other sectors have been moved ahead. I think 4.1 and some of the libraries and museums happening next week. A lot of things have been pulled up a bit because we feel we can safely do that. I don't think the other sectors have been delayed, but it's just that they are opening at what we thought would be a good 4-week period between phase 3 and phase 4. So I don't think things are being delayed in general, but I think it gives us the time and space to develop guidelines, get feedback from those sectors, and make sure that those sectors are confident to open in a way that they can provide as safe as an environment for customers, because customers also need to understand how it'll work and feel safe when attending. And that's another thing that I'll just like to say, that we talked a bit about private events also, that everyone also needs to be comfortable with what they feel comfortable doing and what they feel comfortable not doing, and move cautiously. We all have different risk levels of risk tolerance, so we all need to be comfortable with what we are comfortable doing. And one of us may go and see a movie, another may go to a restaurant, and that's fine, but you don't expect everyone to start doing everything all together. But I think we all need to ease into this in a way that we feel comfortable, we feel safe, and if we have close contacts with people who are at higher risk, we all accommodate each other during these events to make sure that everyone feels safe and comfortable as we reopen.
We'll take our next question on the phone line.
We have Phil Tank with the Star Phoenix.
Yes, I see that you've now made it mandatory for workers in restaurants, care services, and gyms to wear masks when physical distancing is not possible. Why those in specific and not other ones?
So I think we have relaxed the guidance, and the way I'll explain it is that, so there's a hierarchy of controls. The first, of course, is don't engage in activity if it's not safe. And we've gone over that in terms of we are able to now safely reopen many activities, but based on your own risk assessment, if you feel you can participate. And then there's kind of administrative controls where doing it in a way that there's less crowding, for example, 50% capacity in restaurants, other controls in gyms or other venues where you have that spacing all the time is essential. And then we've already seen in retail outlets where you have engineering control, which is a barrier. So all those layers are important, and definitely being able to maintain that physical distance is more important than not being able to. Having a plexiglass barrier where it makes sense is important. But if you are in a situation where, for example, you're getting on a bus and via rail and airlines already require that, but if you are getting on a bus and you see that there isn't a lot of space in the bus, having that mask in your pocket to put on, cloth reusable mask is an important extra layer. And if everyone uses a mask where you can't always maintain that 2-meter distance, everyone is protected. So that's something that I think I just want to start emphasizing. And also in a lot of the industries like restaurants and personal care services, obviously in a restaurant, the people who are enjoying the food can't wear a mask, but and the servers already are behaving in a way that they minimize contact within 2 meters. But if they wear a reusable mask, that gives an extra layer of protection as well. But that's just an extra layer of protection. You shouldn't wear a mask and then try to get closer than 2 meters where you don't have to. And same principles will apply in other settings like personal care services. So we just clarified some of the guidance, made it easy for most of us just to have a reusable cloth mask, 1 or 2 on hand that we can reuse. But then, of course, in some settings like medical care, you need a procedure mask or a surgical mask.
Follow up, Phil?
Does this represent a change in philosophy on masks? Like, I think there's been some confusion over here over what the recommendation is from from Saskatchewan Health, and I know worldwide it's been back and forth, and some people have recommended them and some people haven't. But I'm just wondering if you could very clearly say what your recommendation about masks is right now.
So I think we need to be very clear that this is a marathon. So this is 12, 18 months. And so when I go out for a walk, for example, and I'm sure there's no one going to be even 5 meters away from me, I'm not going to wear a mask, because why should I? I can guarantee that I'm not a risk to anyone and no one is a risk to me. And then when we are here and I have to talk, and as long as we can maintain the 2 meter distance, I think it's fine not to wear a mask. But if I'm in a setting where I may be, for example, in a retail location where so far all the retail locations I've been to, it was easy to maintain the 2 meter separation. I think everything has been laid out very well. But as we go into other settings where that should always be the case, but where I'm not confident, it makes sense to wear a mask, and especially transit and some of those settings. And there's also good evidence now that if everyone wears a mask in those settings where there's crowding, mask use can reduce transmission significantly in addition to the 2 meter separation. And I think that is also really important, because we have to realize that we now have to go to school, go to work, shop, enjoy other amenities in a setting where the pandemic will continue till such time that there's a vaccine, or till such time that after many small waves it kind of becomes either a seasonal thing or kind of dies out. So we do have to then plan for the long run, that we don't expect to go into the same significant rapid lockdown we did in March. Even if we see small clusters or maybe even a increase in cases in the fall, we really don't expect to see the same lockdown that is essential in March, because we had to understand how we can do things better. And so that's where I think, again, testing is going to be critical, contact tracing is going to be critical, maintaining that physical distancing all the time is going to be important. But then as an added layer, having a reusable mask and putting that on when appropriate, I think is going to be an extra layer that all of us should think about and practice. How where do we keep it? Do we put it on and off properly? We shouldn't be fidgeting when we wear a mask all the time, because that is not a good thing either. And we can throw it in the washing machine or wash it by hand when we go home. So I think those are some habits that we need to get used to practicing. Not so much when we're out and about, on a walk, but when we're in a situation where 2 meter distancing can be guaranteed. And also, I would say, right now it's summer, a lot of our activities are outdoor, but in the fall, as you start moving indoors, I think this is going to be something very important for us to be aware of and think of.
We'll take our next question on the phone line.
We have Peter Lazinski with the PA Daily Herald.
Hi, I noticed today I was browsing through SAS tenders that the province has a tender out for PPE. I'm wondering if that's because there's a shortage or need for more PPE for the various Crown ministries?
No, I'm not aware of this specific tender, but I know that the Ministry of Health has been working closely with Sask Builds in procuring personal protection equipment, as it has been challenging at times over the course of the last number of months, but we have been able to procure the required amounts of PPE for our needs within government. So I'm not aware of the precise tender that's out there, but I do know that the Ministry of Health has been working closely with Sask Builds on these procurement procurement initiatives on PPE.
You have a follow-up, Peter?
Yeah, and we've been talking a lot today about masks and changing mask messaging. Is there a plan to either communicate to residents the need to, or the recommendation they should be wearing masks, or to go down the Alberta route of offering masks through drive-throughs?
Through which?
Drive-throughs.
Oh, you want to comment on that?
Yeah, I think at the moment, I'll certainly be talking more about masks in general, and I think all of us need to think about, what kind of mask do we want to get for ourselves and our family members. Children under 2 recommended not to wear a mask. I think that may not be safe or appropriate. But certainly, all of us need to be comfortable about how and when we will use masks, what kind of reusable masks we want to get, and I think it's good to start thinking about that. Certainly, if we were to see a fall surge, sometimes it's hard to get a mask, and many people make very nice masks of their own, which is great. I tried to make a couple of masks with my son's T-shirt that did not work out really well. So I just bought a couple of masks. But I think we just need to start thinking about having sufficient masks at home to use when required, and do it over the summer before. If we were to see a fall surge, we all have masks, we all know how to use them. And I think that's just something we just need to, an additional thing we need to learn, apart from all the other good stuff we've been doing like physical distancing and everything else.
Are there any further questions from the room? Murray?
Mr. Premier, everything that you've announced today allows, except I think for other province travel, would allow for something like the Canadian Junior Football League to commence a season. I know that's not where you're going yet, but have you put much thought into the reopening or allowing a reopening of leagues? I assume you've probably had a fair bit of lobbying to do so at some level, because this starts the fall stage. But let's start with the Canadian Junior Football. Might that be the first, given the fact that
there has been some discussions with respect to sports and sporting events, and then sporting events where there's a larger number of fans there, and Dr. Shahab, you may comment as well, but first and foremost is to have the safe play parameters in for the people that are playing the sporting event, the coaches, those that are directly involved. Then the second is to have safe parameters in place for spectators. But there's some very preliminary, I would call them, discussions with respect to some of our leagues, and maybe not directly the CIS or anything along those lines, but I think of the SJHL as well coming this fall, the WHL, all gate-driven leagues, much like the CFL, which is ultimately the largest sporting events that we have. Is there an opportunity to have these discussions on how this may work? And I think first and foremost, Dr. Shahab had said this is a marathon. We do need to look out over the next number of months, not the next number of weeks, in continuing to be safe. And our situation may change as we go through time with respect to what our numbers are, how those cases are being transmitted in our communities. But there is some very preliminary discussions on, really, first of all, let's get the safe play parameters in place, and then second of all, can we even have a discussion about, some larger groups in some of these venues? Many of these leagues, the CFL being the largest among them, but the SJHL, the WHL, the CIS, university football, a little different, but other football leagues are very similar. They're gate-driven leagues, right? And so they don't have the TSN marketing rights and things of that nature. So there is those very preliminary discussions going on. There's many challenges with how that could potentially work, and we haven't came to any decisions as of yet.
What form are those preliminary discussions taking place? Are you striking a committee to pros and cons? I suspect it would require the expertise of someone like Dr. Shahab, and within the parameters of discussion, it takes a while for leagues like all these leagues to reset, and particularly the closer you are to a fall activity like football, the more difficult it would be to happen immediately. But at this particular point, is there's been some structure within the decision-making group as to how these things can be moved forward? How are these decisions now being assessed and/or made, sir?
Yeah, well, the structure would be that Dr. Shahab and his team in public health have been meeting with the various associations on the safe play guidelines. We're seeing some of that put forward here in the last week or two, and again today, to ensure that the people on the field are able to stay safe, the people that are directly involved. The second is, again, through the committee, I suppose, would be Dr. Shahab and his team working with the individual leagues or a collection of leagues. Like we have a number of hockey associations or leagues that have come together for a more collaborative discussion, if you will, because the challenges that they face, for example, in the SJHL are very similar to what they face in the WHL. The same in many of our football leagues and others. So they have come together in their groups to have at this point very preliminary discussions, but as to is there some parameters that we can look at where there could be some opportunity for these types of events to go forward, later this fall into the winter. Now, the caveats to that are one is things may change between now and then, and they may change as we get into a league or anything of that nature. And two is there's no guarantee that we will be able to move forward with this in a safe manner. Public safety and minimizing the opportunity for the spread and managing the spread of this virus needs to be paramount at every opportunity. I don't know if you have anything more to add to that, Doctor, but that's really the two areas that I've been aware of.
Yeah, I think what I would say is that for recreational leagues, we already talked about outdoor training and maybe playing in a bubble. For professional leagues, it's more complicated. It's your workplace, so in some ways it's more structured. There may be more emphasis on testing. But then for competing, what kind of bubbles do you make? There's larger groups of people who provide various types of support, coaching, training, other sports. I think all those considerations from a workplace environment perspective also need to be taken into account.
Adam?
We've seen more data on hospitalizations shared over the past number of weeks. Is there going to be publicly posted how many ICU admissions we've had total, how many ICU recoveries we've had, and also the total number of hospitalizations? The chart right now isn't set up that way. Well, I'm just wondering if that's going to be made public anytime soon, or if we can get those numbers.
Yeah, we can bring that back. Like I think in the past I did speak to total number of cumulative hospitalizations and ICU admissions by age groups and risk factors. So that certainly we can bring that back again. Yeah.
Thanks very much, everyone. That concludes your time for today.